Good morning. Hi there. This is Gilbert here with my producers in the studio. We've got Zam and Achu. Very good morning to you who just happened to join us. Well, as you know, every day from Mondays right up till Thursdays, we've got different topics on Momentum Interview of the Day. Now, today, it's going to be a real interesting topic, health on Traxx, and we'll be talking to our guests in the studios now. Just before we get to know our guests and talk about our topic for today, which is a very interesting topic, expert tips on safe workout. Now, if you happen to be one of those who just happen to be outside, outdoors, or probably indoors, and you just like to work it out, well, just like me, I was talking to the good doctor here on how do you take care of your muscles before you get on the action. So stay with us right here if you'd like to find out more details on our topic for today. Now, just to let you know that our listeners, we are live on YouTube and TikTok. That's TRAXXfm official. Look for us, and also on Facebook Live, which is TRAXXfm. So any questions, probably like to say hello to our good doctor in the studios, you could do so on our social media platform. Now, as we settle into the new year, well, many people are settling fitness resolutions for 2025. Now, if you have set your fitness resolution, some of us don't even keep up to it when it comes to mid-year, but nevertheless, how do you do it and you do it correctly? So that's what we're going to talk about today. Well, it says here that recent incidents of individuals being rushed to the hospital after intense workout, and this has raised concerns. So our interview today, we're talking to consultant nephrologist, Dr. Wan, and better known as Dr. Wan Mohd Rasis, Wan Ahmad Kamil. And he's the consultant nephrologist, Prince Court Medical Center. And today, very, very interesting topic, sharing the principal tips for exercising safely. And well, it's so nice to have the doctor in the studios with us. Very good morning to you, doctor. How are you, doctor?
I'm good, thank you.
All right. And doctor, I think we are going to be tackling into a very interesting topic today, especially for those who, well, they will probably want to know expert tips on safe workout before they get in action. Right, doctor?
Sure, yeah, that's very important.
Yes. And okay, so doctor, could you just tell us a little bit more about yourself?
All right, I'm Dr. Rasis bin Ahmad Kamil. I'm a consultant nephrologist. I'm working in Prince Court Medical Center. I'm also an internal medicine physician as well. So I deal with lots of kidney-related diseases, basically kidney diseases which leads to either chronic diseases or acute diseases, and mainly pertaining kidneys and kidney health as well.
Okay. And how long have you been in this field, doctor?
All right, so I've been working as a doctor about 20 years. I've been a nephrologist for about 5 years plus, and I've been an internal medicine. Internal medicine takes care basically of all the other organs as well.
Right.
Yeah.
And basically today is all about muscles.
Correct.
Right?
Yeah.
And how to take care of it before we get into action.
True.
Okay, so jumping into our topic today, Dr. Wan, could you just tell us a little bit more, or can you briefly explain what rhabdomyolysis is all about and how it relates to intense exercise?
All right. So I think the term of rhabdomyolysis is quite a difficult term to say, but to summarize or to make it more simple to understand is basically it's when you exercise and you use strenuous exercise on your muscles.
Right.
So when you do exercises, your muscle will work harder than usual. And if you work harder or more intensity, the muscle will be working harder and more strenuous. So at a point that the muscle can break down, if it's too hard or if it's even at a moderate intensity. So when this happens, basically the muscle will be damaged. Of course, muscle can regenerate after a few hours later or a few days. But when that damage happens, they will be excreting a lot of enzymes. So these enzymes, as we call as, the simple names are creatine kinase, lactate dehydrogenase, aldolase. All these kinds of enzymes will be excreted into the bloodstream.
Okay.
So on an intense exercise, the muscle will be broken down in very fast, and more of these enzymes will be released.
Okay.
So when these enzymes are a lot and accumulates in the bloodstream, this is when you get these terms as rhabdomyolysis. So the enzymes that is overwhelmed and too much for the body to handle.
Okay.
Because of the muscle breakdown or the damage.
All right. All right.
Yeah. So in normal situation, the muscle will break down, of
Okay.
course, but not in terms of a lot of this kind of enzymes
So
released.
it's not basically building muscles, but breaking down the muscles if the warm-up is not done properly.
Correct. Yeah. So if you do a warm up,
Okay.
you warm up the engine, like
Okay.
warm up engine, so the muscle can accommodate to that kind of exercise that you're doing it.
Okay.
So as it goes slowly and then a moderate intensity and then a higher intensity, so the breakdown will not be tremendous or will not be a shock to the muscles. So if you not started the engine for some time,
Right.
it'll be a shock to the muscles and they release more of these enzymes. So that's the term of rhabdomyolysis.
Okay, so there you go. Explained by Dr. Wan on rhabdomyolysis. Now, doctor, what are the warning signs? Now, as you know that when you do not have enough of warm up and when you just get into action and you just go to straight away to fourth gear, that's intense workout,
Yes.
and then you have muscle breakdown. So, what are the warning signs of rhabdomyolysis?
All right. So I think the most important thing is that if you feel a sharp, a very abnormal pain on your muscles that has not been there before. Okay. If you are a regular person who goes for a jog or who runs marathon, usually they don't feel this kind of pain in the muscles. It's because they are used to it. But if for a first timer or maybe a person who hasn't done marathon for some time or going into high intensity, they will feel a sharp pain in the muscles, and sometimes they feel more fatigue. Most extreme situations they can go into vomiting, and you can also pass out as well. So those are the kind of warning signs that you may be developing rhabdomyolysis as well.
Okay, doctor, this one here is not in my question
Sure.
sheet, but this is something personal because I do train and things like
Correct,
that,
yeah.
right? When you do certain distance,
Yes.
and you can feel that your shoulders are getting very tensed up,
Yeah.
is that a warning sign, doctor?
Well, muscle breakdown basically not towards the normal type or you're used to can also cause some muscle pain as well.
Okay.
So that may be an early signs that you are developing rhabdomyolysis. Rhabdomyolysis is a severe type of muscle breakdown.
Okay.
So you may have that kind of muscle breakdown already. That is a warning
sign.
to you and to stop and maybe
Slow down
slow
a
down.
little bit?
Yeah, correct. Yeah.
Okay,
Yeah.
so there you go. Okay, this is personal.
Yeah.
All right, doctor, are certain types of exercise, such as high intensity or probably training, which is likely to cause rhabdomyolysis, types of exercise, doctor?
Okay.
How does this work?
Sure. So I think the concept of rhabdomyolysis is quite severe. So you may have some muscle breakdown, as I mentioned to you earlier, when you are doing some moderate intensity or low intensity for some
Right.
people.
Right.
But in the event that you are doing high intensity, like the high intensity interval training (HIIT), those are quite strenuous and those are quite vigorous
Okay.
and non-stop.
Okay.
So the intervals are just maybe about 1 minute or 2 minutes interval, and you go straight along for 30 minutes of high intensity. So those kind of trainings that may cause your muscle to be in shock, and they don't have time to recover after each interval. So I think the most type of exercises are the high intensity straight away, rather than going from a slow to moderate and then to a higher intensity over days, not in 1 hour. And I think the most classic example is the spin classes. So when the people go on for cycling, which is quite strenuous and high intensity without stopping,
Okay.
maybe intervals will be just less than a minute.
Right.
So the muscles can't get any time to recover from that kind of intensity. So those are the kind of examples of high intensity exercises that may cause or potentially cause rhabdomyolysis.
Right. So that means warming up is very important. Just before we take a short song break, doctor, just one more question here. What are some common mistakes or misconception people make when starting intense fitness routines? Anything that you would like to advise our listeners here?
Yeah, I think for first timers, it's more important to go to a warm up, a simple warm up and less intensity, rather than going straight to the friends that your friends are regularly going for activities, and you have never been to this kind of activities before. So I think warm up is very important.
Okay.
Number 2 is you need to keep yourself well hydrated, meaning take a good amount of water before you go for any of these kind of trainings.
Okay.
Before and after.
Before and after.
Yeah,
Very important.
Yeah, very, very important.
Replacing back your fluids and things
Exactly,
like that. And also the muscles, right, doctor?
Exactly. So the muscles need that.
So there you go. Just a very nice explanation and also advice from Dr. Wan, who is a consultant, a nephrologist, Prince Court Medical Center. And we are talking about a very interesting topic here, which is the expert tips on safe workout and what actually is rhabdomyolysis. We'll be back in a bit right here on TRAXXfm. Stay with us. Don't go anywhere. Welcome to the show. Hi there. Very good morning. This is Health on Traxx Momentum. I'm Gilbert together with my producers. We have Zam, we have Achu in the studios. And if you just happen to be on our social media platform, well, on YouTube and TikTok, it is TRAXXfm official. On our Facebook Live, it is TRAXXfm. Talk to us if you have to. I think we've already had a couple of our listeners who have got some interesting questions here. Thank you for your compliments. And while we have Sembang Suka-Suka, who asked a very particular question to Dr. Wan, who happens to be the consultant nephrologist from Prince Court Medical Center. And well, Sembang Suka-Suka would like to know, can one develop or have this particular issue, which is rhabdomyolysis, the breakdown of muscles, after playing video games?
Okay. So thank you for the question. I think in related to rhabdomyolysis, it's more of usage of the muscles excessively.
Okay.
So in terms of video games, I'm not sure if you are doing virtual reality where you are using your muscles excessively. You can potentially do that if it's too strenuous. But if you are sitting down in a normal video game,
right,
you won't develop, or you should not develop rhabdomyolysis.
Should not.
Should not. Unless you're doing the virtual reality, as I mentioned to you, that you're using your muscles excessively without you realizing.
Okay.
All right.
Well, I think Sembang Suka-Suka is asking about brain muscles. Strategizing.
Yeah.
Okay.
Yes.
Well, expert tips on safe workout. And Sembang Suka-Suka, thank you so much for your question here. And well, Dr. Wan did answer your question, if only when you're in intense muscle usage. Okay, so there you go. Doctor, jumping in back into more of our questions now. Now, I would like to ask this one here. Now, how can we differentiate between normal muscle soreness and more serious symptoms of rhabdomyolysis?
All right. I think that's a great question. Because some of the people, they can't differentiate. You know, you have, like you said earlier, you had some muscle soreness after running for a while.
Shoulder.
Yeah, shoulder pain or a muscle soreness. So in rhabdomyolysis, which is more severe aspect of the muscle breakdown, is when your muscle suddenly becomes bigger. All right, it becomes bigger than usual, especially after you've stopped. You know, you've run a marathon and you've noticed that your calves or your hips are large, bigger than usual.
Okay.
So that is also one of the what do you call that, signs that you may have rhabdomyolysis.
Okay.
And when the muscle soreness or the pain, I usually say pain, it becomes so severe that you can't even bend your knees, for instances.
Okay.
Especially after spin classes or marathon, you can't even bend the knee because your hamstrings or your thighs are so tight and big.
Intense, right?
Yeah.
Okay.
So those are the easiest way that you can for a person to know that they're having rhabdomyolysis, especially if it's so severe pain. There's muscle enlargement. And last but not least, of course, the other symptoms I think we will touch on later. But the most important things are the muscle hypertrophy, or you say it's muscle enlargement, and pain and severe pain. Yeah.
Doctor, to solve this problem, do you think that stretching, when you have this issue, stretching, is it important?
Okay, so in the event that if it's too sore and too painful, definitely stretching would maybe cause it to be more worse. Okay, but if you have muscle soreness, that there's no enlargement of the muscles and you can still bend your knees, for instance, then warming down after doing a high intensity workout can help to relieve that kind of soreness as well.
Okay. Okay, doctor. Are certain populations, such as beginners or those underlying health conditions, are more at risk of this particular issue, which is rhabdomyolysis?
Yeah, definitely. I think so for populations or people, especially like you said in the earlier, that New Year's resolution that you want to go on for a healthy lifestyle, which is very good, very important in the long run. But I think you are more prone to get rhabdomyolysis because you may as well join into your friends or people who have been on regular exercise into a straightaway high intensity. So beginners usually when I see in my practice, those who come in with rhabdomyolysis are usually beginners. First time, they've never done any kind of activities like spin classes or high intensity interval training. They've never done it before in their life, and they jump straight into that. So usually those are the beginners. Number two is those populations that people who have rested for quite a years, quite some amount of years. Like they've run marathons like 10 years ago, and now I want to run another marathon, and I straight away go into the 45 kilometer of marathon.
Right.
So those are the types of people that can potentially get rhabdomyolysis.
Rhabdomyolysis. Okay, so there you go. Explained well by Dr. Wan here. And as I said, it's a very important topic. Expert tips on safe workout and what exactly is rhabdomyolysis. So Dr. Wan did explain to us. He's a consultant, nephrologist of Prince Court Medical Center. And moving on to more of the questions here, Doctor. Now, if someone experiences symptoms like muscle weakness, swelling, as you mentioned earlier on, or probably dark-colored urine after exercising, what steps should they take? How dangerous this is, and when should they seek medical attention? I never heard about this one here. Dark-colored urine.
Okay, so as I was going down to the symptoms as well, other than the muscle enlargement, muscle soreness, or severe muscle pain, if the symptoms are untreated, or basically it is more prolonged, you can potentially get dark-colored urine. Okay, dark-colored or blood in the urine. This happens when the muscle breakdown, as I mentioned earlier, releases all these kind of enzymes.
Right.
So these enzymes will accumulate in the body or the blood, and will go to the kidneys. Okay, so that comes to my specialty. Kidney. So when that happens, it clogs up the kidneys. You imagine kidneys like a filter. All right. If the enzymes are quite big and large, they cause blockage to the filters. All right. So when this happens, the filters itself will be damaged, and they can potentially have like tears or breakdown of that filters. So that can cause the blood inside the urine as well. So when that happens, that's quite severe already. Mainly the enzymes that I mentioned to you has accumulated it tremendously and has blocked up the kidneys, and potentially can cause the kidney to fail acutely or immediately. So that comes to the life-threatening complications of rhabdomyolysis itself.
Okay.
So when patients have that kind of symptoms, it starts with muscle soreness, muscle enlargement. If they stay at home, they don't do anything, they don't go and seek medical treatment, and they feel tired, they don't drink that much, then the next step, they will produce dark-colored urine and blood in the urine. So that potentially can cause harm to the kidney, and you need to seek immediate medical treatment as well. Yeah.
Okay, doctor. This one here is not in the list.
Sure.
Now, if you have this muscle swellness, what could you do immediately? Ice, does that work?
Okay. I think I'm not an orthopedic doctor, but definitely you need to bring down the inflammation or the pain. Definitely ice packs can help. Resting, doing a warm down exercise can also potentially help that. Drinking lots of fluids also will help that as well.
Very important.
Yeah, right? So when you have that kind of muscle, you feel tired, you don't drink that much, so all this can accumulate
issues like this. Okay, so that explains why footballers get themselves into ice cold bucket right after an intense workout, right?
Yes.
Okay. How is rhabdomyolysis? How is it diagnosed, and what happens if it's left untreated?
Okay, so the immediate response after experiencing all the symptoms I mentioned to you, that the muscle pain, urine that has come dark or blood colored, you need to seek medical attention straight away. The only way to confirm this is by taking a blood test to see whether the certain enzymes are raised. So certain enzymes that I think you can highlight here is basically creatinine kinase, which is also a breakdown enzyme from the muscle damage, which accumulates, and it can go up to about 10 to 100 times up from the normal limit. So imagine if the limit is about 100, you can go up to about 100,000 of readings of that creatinine kinase. So from there, you can identify that it is a potentially rhabdomyolysis with that symptoms, and also as well as the blood test as well. and then you need to check your urine whether there is any evidence of blood in the urine as well.
Okay.
Yeah.
So that's where the
Yeah.
enzymes are all. Okay. So it's alarming if you do not know the right method of
Yes.
starting a intense workout and things like that, and how do you warm down. Uh, Besides athletes and people who are always on the go, doctor, can old age also, without you doing any workout, can that happen?
Okay. So I think rhabdomyolysis in it happens in other kind of diseases as well.
Okay.
All right. So like crush injury, if you had a motor vehicle accident, you were crushed by the car or something fell down on your body, that is the most common causes of rhabdomyolysis.
Oh.
So exercise are less common.
Okay. Part of it only.
Yeah. So in old age as well, of course, it's the same concept. If you exercise too much beyond your capacity or your capability or what you're normal to, then it can definitely potentiate rhabdomyolysis. But if you are fit, 70 years old, you've been doing a lot of exercises,
Right.
so it should not happen.
Okay.
Yeah. So the most important thing is to keep fit.
Not just at the later stage,
Yes.
but it has to be a consistent discipline that you should
Correct.
have.
Yes.
Thank you so much, Doctor.
No,
What an interesting topic here. Thank you to our listeners who happen to be on YouTube, TikTok, and also on Facebook Live. Thank you so much for all your questions and also the compliments. Oh, yeah. Okay. So Achu has got one more question here. Okay. Can you reduce rhabdomyolysis if you take drinks? These drinks are like what should I say? I wouldn't want to mention the brand,
Okay.
but drinks that has
Okay,
to replace
so,
bacteria.
alright, okay, okay. I think that's a good question. The most important thing is to replenish yourself with any kind of fluids. So if you drink your mineral water, which contains quite a lot of sodium chloride and all those things are enough to maintain or to prevent. So the most important thing is not the type of water, but it's the amount of water that you take.
Okay.
All right. So there's no specific brand, there's no specific name, but I think just normal fluids or water that you take maybe about 2 liters, or 3 liters pre or post after your workout.
Okay.
Yeah.
All
So
right.
that's most important.
There was also another question, Doctor.
Yeah.
Some of them have said here that on our, I think it's one of our platforms, right?
Sure.
If there is intense dancing, that was a good one though. Intense dancing, can that also cause rhabdomyolysis?
Okay. So from my experience, I've never seen any who came in with but you can, theoretically,
why not? Yeah.
if it's using too much muscle and there's no breaks in between. So the keyword is the intensity of the whatever
Usage
you
of
are
your
doing.
muscles.
Yeah.
Okay.
And there's no break in between. I think that's more important.
Okay, so there you go. Don't break dance too much. Doctor, any advice that you have for our listeners here when it comes to starting intense workout and to ensure exercise is done safely to avoid rhabdomyolysis?
All right. Okay. I think I've mentioned in a brief in a few of my answers, but to start your workouts, you need to at least warm up. You need to do a low intensity first, and then gradually build up that intensity.
Right.
Don't straight away jump into high intensity. Make sure you take a lot of water, fluids. Whatever fluids, orange, juices, any normal water is also okay. Pre and post of your workout. The thing happens is that if you feel so tired that you don't drink anything and you go home and sleep it off, and you don't take any fluids, that can potentially cause a risk of rhabdomyolysis.
There you go.
And then I think last but not least is pace yourself at your own pace. Don't follow your friends, especially in spin classes when you are in a lot of people behind you. You can't break down. You can't stop, because if you stop, you feel ashamed or you feel that you are weak than others. So I think the most important thing is to pace yourself, know yourself better, and if there is any signs that you have any muscle pain or you're tired, just stop.
Okay.
Yeah.
So, the thing that people say, control macho, well, I think that has to be out of your term, right, Doctor?
Correct.
Okay, don't, because your body actually talks to you. All you have to do is just listen to your body, what it's trying to say. So there you go. Thank you so much to Dr. Wan. Mohd Rasis, one Ahmad Kamil, who is a consultant nephrologist, Prince Court Medical Center. Our topic today, expert tips on safe workouts. Thank you so much, Doctor.
Thank you very much for having me. Thank you.
Thank you. And to our listeners on YouTube, TikTok, and also on Facebook Live, thank you guys for all those questions. Very interesting question, isn't it? Momentum, Health on Traxx on Mondays, different days, different topics from Mondays right up till Thursdays on the second hour of the show. It's a build up to the midday news. Thank you so much to my producers. I have Zam and Achu here with me. And I'm Gilbert, back after the midday. Stay tuned. TRAXXfm, Momentum.